question, please, related to assessment, to course, to everything, you can interrupt me during this lecture. Oh, the end of the lecture, we are talking about Gashbin. You raise your hand, Gashbin. It's okay. The end of the lecture, we are talking about to fix some related problem issue with this group is because of optometry is shared in the system on with the MLT and with the medical imaging. After that, decided which time is suitable for them. But now I'm going to talking about this course. As you know, this course code is SBU 137, and the title is the Red Crescent 3. You should take it the Red Crescent 1 and 2 is code is SBU 117 and SBU 127. The main purpose and the main aim of this course is this advanced first aid and advanced cardiac pulmonary resuscitation. How can management of medical case, surgical cases, main injury management and trauma case. And we are talking about this teaching method, including lecture and stimulation training. Now, course contain a lot of interest topics. This topic is need for everyone and is the responsibility of individual in the society. Every student, every person responsible to myself, yourself, and your family, your society. If you can help them to save life is a big goal. And you imagine to help someone in the pain, help someone is life-threatening, you can save a life is I think is bigger than anything in the life. Your topic, this course going to bleeding control. If you remember last year in Red Crescent 1, also talking about this and describing this, but it's not very deep, just basic of the first aid, basic of the first aid to bleeding, to shock, to head and spinal injury. In this course, more deep and more stimulation, we imagination to practical of this basic. Sorry, I have a call with the university. I think some student even have a problem with connection. Sorry. I think your slides is not changed, but now change, yeah?
This
Yeah,
now
that's
changed.
even now?
Yes.
No, it's not changed.
No, it's changed.
Okay, thank you. We talk about the topics. The topic is bleeding control, shock, and chest and abdominal injury, and all of emergency situation of surgical and medical case. Surgical case is main about injury, burn, and trauma, bleeding also. What's about medical case? Who one can tell me what's the medical case? What's the emergency medical case can provide it first aid? Who one not now what's the medical case?
Mister, you mean something like an accident that happens in which we need to perform a first aid procedure?
Can you give me
Is that
example?
what you... An example is maybe anything that, like the ER, basically the patients that come in, maybe someone who got in an accident or something.
What's the main accident? Accident main is cardiac accident or fall or something like this?
I mean, yes, any accident that
It's related to
requires
surgical.
to perform...
Yes, thank you. So, but it's related to surgical. I mentioned if bleeding, injury, cardiac accident, or fall is related to surgical case, emergency surgical case. We have also emergency medical case. Emergency medical case is case not any accident happened. For example, seizure without any accident, you show cardiac arrest, myocardial infarction, CVA, and may you go to my room. I am loss of conscious is a medical case without any fall, without any electrical, without any burn, without any external force. Is a medical, maybe high blood pressure, maybe diabetic, or as mentioned, myocardial infarction is related to situation without any force, loss of conscious, and asthma. Asthma case is a medical case, emergency medical case. Regarding the assessment and evaluation, most of them, most of you have a question about this. This course, stimulation evaluation is the main point. Have a lot of degree of stimulation evaluation by 2 times stimulation, 60 degree in the stimulation. What stimulation evaluation is main case study. Case study, we have a topic regarding the triage, how to triage some case. I give you 4 or 5 of, I give you scenario about cardiac accident in the street. We have 6 victim, 2 of them child, 4 of them adults, and 1 of them loss of conscious in the car. One of child is crying, another absent between the chair, and one of the front have a bleeding in the arm and shouting about pain. How to triage this case? How to uh, uh, determine what's this emergency case? What's the first case you need is first aid? Stimulation like this. Or I give you the case regarding the burn. I told you sign of the symptom of the person have a burn is neck and both arm have a blaster and some area is blacked. What is your treatment? What's your first aid to give this case? This stimulation, and a lot of degrees this course going to stimulation. Maybe it's your stimulation, yeah, evaluation during the class. For example, now I give you case and ask Gershwin, ask Akar, ask Yusur, anyone in the list, please tell me what you do for this case. It's clear? Please, if not
Yes.
answer, just react it to now you are in the class. Okay. Visual assessment, or maybe change it to right assessment, is before you are take it true, false, and multiple choice. Discussion, poster, and seminar was decided between one of them. You take a seminar or poster regarding one topic. Inshallah, in the next week we'll mention it. The topic is you need to seminar or poster. Any question regarding assessment or evaluation or degree? No question? Okay. Now we are going to learning outcome. As mentioned, why you take this 3 semester of the Red Crescent 1 and 2 and 3? What's the main purpose of this? We will be able to explain advanced first aid, steps and handling, cardiac pulmonary resuscitation, choking victim, and managing emergency medical and surgical situation to provide first aid. Teaching plan and schedule. We have a 14 week. Every week, unfortunately, now it's online, 1 hour online, in every Sunday at 11 to 12, and covering the topics I mentioned before regarding the first advanced first aid and cardiac pulmonary resuscitation to the victims, and assessment to the patient, and the handling and the endorsement with the medical team. I want to know your opinion regarding the, if I recorded the lecture and put it in the system during the lecture, just a case scenario and just talking about the cases and evaluations case, how managing, and if you have any question in the lecture and the video during the online, share it. I want to know your opinion. Who one disagree with this? Who one have another idea? Please raise your hand if you agree with this. Good. Okay, thank you. Please raise your hand if you disagree of this. Disagree. Okay, I think it's 10 student, no agree, no disagree. His main is not here, is absent. Okay,
دكتور گیان
okay. You don't choose anyone. Agree or disagree with idea.
زۆر باشە دکتۆر گیان نازانم تاوای تەلەبەکانیش ئەو بوو کە ڕازی بووم بەرامبەری
Oh, okay. Thank you. The reference of the courses is guideline of Malaysia Red Crescent, even Red Crescent in Iraq, and American Heart Association, also American Red Cross. Is all topic references coming from there, and you have for around 41 hour. This main this contact hour. We have 14 to 28 contact hour and another 2 practical hour. You prepare some seminars and some report. And you should, after this course is the third course, you can solve an advanced first aid to all situation. If all emergency situation needed to first aid, you can do it. At the end, any question, any extra, anything? No question? It's clear? Good. Inshallah, see you next week in the same time. So online also. And before put the video and the lecture, PDF lecture or PowerPoint in the system. Zainab, you raise your hand and lower. Okay.
Sorry, it was by accident.
It's okay, it's okay. ئاکاچیان با لە ئێوە دەست پێ بکەم ئێوە ئەتانەوە لەگەڵ میدیکەڵ ئیمەیجن بن یا لەگەڵ میدیکەڵ لاب
واتە چۆن کاکتۆر
ئێستا ئێوە لە ئەگەر دیقەتی دینەکەتان نابێت سیستەم لە هەردووکیانە هەن لە بۆ نمونە من ئەتێندانس وەگرم لە هەردوو بەشەکە ناوی ئێوەی تایە
باشە
کاتی گونجاو بۆ ئێوە ئەوەیە لەگەڵ میدیکەڵ ئیمەیجن بن وایە لەم کاتایە
لەم کاتەیە بەڵە بەڵ
ئۆکێ کەواتە بەین
ئەو جەدۆلیش کە فاکەڵتی دایناوە هەر دیارە بە پێی مەجای دیپارتمنتەکان بۆ لەگەڵ دکتۆرەکان
تاو مش مشکلە نیە چکە من لە هەردوو کاتەکە بۆ من یەکە بەڵام ئێستا نازانم ئێوە لای ئێوە چۆن دەرەکەوێ بەس کاتێک کە با بڵێن کۆرسەکان کە لای من ڕدکریسنتی سەکەیتەوە لە هەردووچیان ئۆپتیمیتری تایەواتە من ئەگەر غیاباتم لە گروپی پێشۆم توانین تۆ غیاب بم چکە ناوی تۆ لەوێ هەیە لە هەمان کاتە لێرەش هەیە
ئەها بەس لەگەڵ MLT شادانرا بوون وایە
بەڵێ
ئەها تاویشەڵاوە خۆم چارەسەرێکە
دەست خۆش لارە پرسیارێکە دەبوو
دکتۆر گیان ببوورە بەڵام لە جەدۆلەکەی ئێمە ڕەکرسن سەعات 12 خراوەتە 11 بۆی ئاگادار بین
جەدۆ لە ئەپدەیتەکە 11
وڵای ئەوەی کە من لامە سەعات 12 ئەپدەیتەکە ئەگەر هاتۆتە لێرناتاو بۆی سەریکەم
هەفتەی پێشوو تقریبان ئەپدەیت کرایەوە یەکەم جار بەو شێوە بوو کە تۆیڵێ بەسەوە لێکتێنە گەشتنێک بوو دوای چاکرا دە بۆ 11 بۆ 12 بەڵام ئێوە لە هەردووکیان دانرابوون لە سیستەم یعنی ئێستا من کە یەم ڕکریسنتی سێ بەڵێمەوە باڵێن میدیکەڵ لاب و میدیکەڵ ئیمەیجین هەردووکیان ئۆپتیمیتریان لەگەڵایە بەڵام خۆی لە ڕاستیە ئۆپتیمیتری لەگەڵ میدیکەڵ ئیمەیجینایە لە 11 بۆ 12
باشە دکتۆر گیان دەست خۆش بە
جا دکتۆر گیان بەنسبەت تایم تێبڵەکەەوە بەس بۆ نوێنەرەکان نێتراوە عنی لە وێبسایتەکەدا نەنراوەیان لە لێرناتەوە
ئەوە کەڵێ خۆتان و لەگەڵ کۆردینیتەرە بەڕێزەکان هاتوارن گینی ئەوە بکەن شوێ مەشار لەگەڵ ئەوان خەریکین ڕێخستنێکەکەین بۆ کاتەکان حتا ئەو ئینتەڕەپتێکمان هەبوو بامۆستا ئاسما دڵنیام هەر بۆ ئەوەیە کەیسە تەواو بێ قسەی لەگەڵەکەم بۆ ئەوەی هەروە بێ یەکەم هەفتە تۆزێک چەند هەفتەی پێشوو دەوام نەبووم هەفتە شەر گەروە وەر نەبوو تاخیر بۆ ئەوەیەوە بەڵام کاتمانە بێ ئینشاءالله هەموو شتەکان ڕێکەکەینەوە
ئینشاءالله کاک دکتۆر
کەس پرسیارێک کەسی شتێکی هەیە ئەگەر پرسیارێک any question anything any addition please tell me the first week is a guide to another week okay take your time see you next week inshallah
دەست خۆش بێ کاک دکتۆر
سەرکەوتوو بن خواتان لەگەڵ